Wikidata.com.
Hi, if you lose a tooth, we can actually replace the tooth permanently using dental bridge. It's a very good treatment plan. Now, after you do the dental bridges, there are people who complain that there is problems with the dental bridge, there is caries under the dental bridge and all those things, and there is a lot of negative marketing which is coming just to put the dental bridge out of the market. Now, why is the dental bridge failing? And what's the other option? The other option is actually to go for implants other than the dental bridge, so that you don't have to grind the next tooth. Dental bridges are kept by grinding the adjacent teeth and then putting the tooth which is actually lost. Now, if whether you grind the tooth or whether you grind the bone, you have to grind something which is natural to put the tooth there. So, dental bridges, and for me dental bridges and implants are almost the same. Either you grind the bone or you grind the tooth. Now, and if it is possible, then we can go for a bridge or even an implant, that doesn't matter. But today we will talk about what are the follow-up treatments for keeping the dental bridge in the best hygiene and to get the best treatment effects. Now, why does it fail? See, one problem what people say that there is a lot of food getting in between the dental bridge, or there is a lot of bad smell after the bridge. Now, in the dental bridge, if you do it properly, if you can do a proper dental bridge, there are spaces which is kept so that you can actually keep it clean. When you brush, actually the brush bristles go under the bridge and then it gets cleaned. Or when you wash your mouth, if you can rinse it properly, then the food under the bridge also will get out. But if you really keep it tight close, then what happens is capillary force will actually take all the food and the liquids under the bridge, and then there will be accumulation of soft food under the bridge, and once it becomes slowly get digested and also get stale, then there will be bad smell. So, actually there is something called as a sanitary pontic or a modified original pontic, wherein most of the areas are actually cleanable. See, this is one of the major reasons why they say that you should not do dental bridge. Even in an implant bridge, the same thing happens. So implant bridge or dental bridge, food can get under the bridge and then you can have to clean it up. So that is always there. Now, second thing is, what you have to do is you have to make sure that the dental bridge doesn't have gum recession. What happens if there is gum recession? There will be teeth which is exposed. If there is teeth exposed, there are chances of getting it onto caries, and then if you have caries, then what happens? The tooth will break and the bridge will fail. Now, for that, what you have to do, you have to go for a checkup regularly. Go to the doctor, check whether there is any caries under the bridge, check whether there is any gingival recession. Even if there is gingival recession, the bridge will stay. Make sure that you don't have caries in the cervical area, because if you have caries in the cervical area, you might lose the supporting teeth and then you might lose the bridge itself. So, what you have to do is, you have to go at least once in a year, if possible once in 6 months, go do a checkup, cleaning, and also check the cervical areas, check whether the bridge has become loose, so that you will save the tooth and also the bridge. This will help you to keep the bridges. Recently, yesterday we had a patient who came after 33 years of having a dental bridge. It's perfectly fine, just because she goes and just does a cleaning and checkup. 33 years, one dental bridge. So bridges are also a very good treatment plan, provided you do the proper cleaning, your proper brushing, and also a follow-up treatment. So to tell you in conclusion, most of the dental treatments are very good in saving your teeth, but the problem is with the follow-ups. If you don't do the follow-up, if you have caries which is coming, or if you have gum problems which is coming, then you might lose the treatment and also your own teeth. So make sure that you go do the follow-up properly. Make sure that you do the design properly. Go to a good dentist, get the design proper. If at all there is a problem with the design, redesign it, do a good one, so that you will have the good teeth and also without any bad smell or having any problems like that. I'm Dr. Thomas Nechupadam, your dental expert on Wikidontist. Please make sure that you subscribe and also send these videos to people who are having problems with their tooth. That means that all your friends. Thank you very much. I'm Dr. Thomas Nechupadam.
Wikidontist.com